Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that sheds light on how antimicrobial medications are being purchased by veterinary clinics that treat companion animals like dogs and cats. As we become increasingly aware of the serious threat of antimicrobial resistance, where bacteria and other microbes evolve to become resistant to the drugs we use to treat them, understanding how these vital medications are being used in our animal populations is more important than ever. This research, conducted across Canada, the United Kingdom, and the United States of America from 2019 to 2021, offers valuable insights into these purchasing trends. One of the key foundations in the fight against antimicrobial resistance is what we call antimicrobial stewardship. This involves a range of actions aimed at using antimicrobial drugs responsibly and effectively. A crucial part of stewardship is the surveillance of antimicrobial use. To put it simply, we need to know how much of these medications are being used and where to understand our current practices. This knowledge helps us identify areas where we can improve, design educational initiatives, track changes over time, and ultimately assess how our usage patterns might be contributing to the development of resistance. However, gathering accurate and timely information on antimicrobial use in veterinary medicine is not a simple task. Ideally, we would have detailed records for each patient, including the specific drug used, the duration of treatment, the dosage, and the reason why the medication was prescribed. While this level of detail is a desirable long-term goal, it's not currently readily available for the majority of veterinary practices or large networks of clinics. In the past, various methods have been used to track antimicrobial use in animals. These include looking at the total amount of medication sold, the amount used relative to the animal population, the duration of therapy, and the incidence of treatment. Many of these methods have been more focused on food-producing animals. National-level data on sales of antimicrobial drugs from pharmaceutical companies to veterinary facilities have also been analyzed. However, this broad overview has limitations. It can't easily distinguish between medications used in companion animals versus farm animals or horses when the same drugs are used across different species. Furthermore, it doesn't help us understand factors at the individual clinic level that might warrant closer examination. Another important point to consider is that veterinary clinics sometimes purchase medications that are actually manufactured for use in humans. Surveillance of sales from veterinary pharmaceutical companies wouldn't capture these purchases, potentially giving us an incomplete picture of overall antimicrobial availability and potential use in companion animals. Given these challenges, researchers have turned to a more readily accessible source of information at the individual clinic level: purchasing data. While not perfect, data on the antimicrobials that a clinic buys may be easier to retrieve within the limitations of current electronic medical record systems. This study embraced this approach, utilizing a novel metric to evaluate antimicrobial use data from companion animal veterinary facilities across 5 different veterinary clinic networks in the United States, Canada, and the United Kingdom. The researchers looked at the total milligrams of systemic antibacterial agents purchased and then standardized this by the number of full-time equivalent veterinarians working at each facility per week. This allowed for a more level comparison between clinics of different sizes and with varying caseloads. Now, let's move on to the key findings of this extensive study. The researchers collected purchasing data from a significant number of veterinary facilities, over 2,000 clinics across the 3 countries. This represented a total of over 12,000 full-time equivalent veterinarians. Over the study period, a staggering 20 tons of antimicrobial drugs were purchased by these networks. When they looked at the overall purchasing trends, some interesting differences emerged between the United Kingdom and North America. It turned out that clinics in the UK purchased significantly higher amounts of a common antibiotic combination, amoxicillin clavulanic acid, compared to their counterparts in Canada and the United States. Conversely, UK clinics purchased substantially less of the third-generation cephalosporins, which are another class of important antimicrobial drugs. The study also revealed a significant link between the size of a veterinary facility, measured by the number of full-time veterinarians, and the amount of antimicrobials purchased per veterinarian. They found that as the number of veterinarians at a clinic increased, the amount of antimicrobials purchased per veterinarian per week tended to decrease. Interestingly, when the researchers looked at the distribution of purchasing across all the clinics, they found that a small percentage of facilities accounted for a disproportionately large share of the total antimicrobial purchases. Specifically, the top 10% of facilities in terms of total purchasing were responsible for roughly 23 to 30% of all the antimicrobials bought. In stark contrast, the bottom 10% of purchasing facilities accounted for only a very small fraction, between 1.6 and 3.8% of the total purchases. This highlights that there are some clinics that are purchasing significantly more antimicrobials than the majority. Within the United States, the study also identified significant differences in both overall antimicrobial purchasing and the purchasing of specific drugs among different regions of the country. This suggests that local factors might be influencing the types and quantities of antimicrobials being used. Furthermore, the researchers compared antimicrobial purchasing patterns between primary care veterinary facilities and specialty referral hospitals in the UK and one of the US networks that had a sufficient number of both types of clinics. They found significant differences in the amounts of various antimicrobials purchased depending on the type of practice. To gain a deeper understanding of specific antimicrobial usage, the study also examined the purchasing of individual drugs of particular interest. For example, they looked at certain higher-tier antibiotics like ceftazidime, ciprofloxacin, meropenem, piperacillin tazobactam, and vancomycin. These analyses revealed variations in which clinics purchase these drugs and in what quantities, sometimes with a few outlier facilities purchasing substantially more than the average. In the case of ciprofloxacin, a fluoroquinolone antibiotic licensed for human use, but with limited oral absorption in dogs, it was notable that some U.S. facilities were purchasing it, while no UK or Canadian facilities did. For a very high-level and critically important antibiotic, meropenem, it was primarily purchased by a referral facility network in the U.S. Vancomycin, another crucial antimicrobial, was purchased by only a very small number of referral facilities across the U.S. and UK networks. Now, let's turn our attention to the discussion of these findings and their implications. The researchers emphasized that while detailed patient-level data would be ideal for understanding the nuances of antimicrobial use, the reality is that most current electronic medical record systems in veterinary clinics are not set up to easily provide this level of accurate detail for large networks. This practical limitation necessitates the use of alternative measures, and facility-level purchasing data emerges as a more readily available option. The study authors acknowledge that all methods of tracking antimicrobial use have their strengths and weaknesses. None are perfect for assessing use in companion animal clinics due to the wide variations in patient types, sizes, and the fact that clinics might use drugs purchased from both veterinary and human medical suppliers. The novel metric of milligrams per full-time equivalent veterinarian per week was chosen to help account for differences in clinic staffing and the time periods over which data were collected. While the number of veterinarians is a useful indicator, the researchers point out that other factors, such as the number of consultations or patient visits, could also be considered if that data were more consistently available. Ultimately, surveillance metrics need to balance ideal measurements with what is practically obtainable. The vast amount of data collected in this study allowed the researchers to highlight potential ways in which such datasets can be used. Their goal was not to judge which clinics or networks had better or worse antimicrobial use practices, especially since they lacked the detailed clinical information needed to assess the appropriateness of use. Instead, the study aimed to evaluate the utility of available purchasing data, identify its potential advantages and limitations, pinpoint gaps in our understanding, and explore different ways to analyze the data. This provides a foundational understanding and can point towards potential areas for intervention and education. The metric used could also be valuable for individual clinics to monitor their own purchasing trends and set goals for responsible antimicrobial use. One of the practical outcomes of this type of analysis is the identification of drugs that might be being used ineffectively. The example of ciprofloxacin in the US is a case in point. Despite its poor oral bioavailability in dogs, a significant number of US facilities were purchasing it. This observation prompted an initiative to recommend the use of another fluoroquinolone, levofloxacin, which has much better absorption in dogs, when an extra-label use of this drug class is deemed necessary. This kind of intervention, based on purchasing data, could lead to more effective use of important antimicrobial drugs. Similarly, the study looked at the use of very high-tier drugs like vancomycin. In the UK network, the researchers followed up with the clinics that purchased this drug to understand how it was being used and to discuss whether its use was always indicated. This outreach and education led the clinics in question to develop internal prescribing policies for such critically important medications. The study's finding of clear outliers in antimicrobial purchasing within all networks, both overall and for specific drugs, mirrors observations in human medicine. This concentration of use in a relatively small number of facilities suggests that targeted feedback and interventions aimed at these high-purchasing clinics could be a very efficient way to promote better antimicrobial stewardship. These approaches can be tailored to the specific circumstances of each facility, such as their caseload and the types of patients they see. It's crucial to remember, however, that high purchasing does not automatically equate to poor practices, and low purchasing doesn't necessarily mean excellent practices. These data serve to identify trends and outliers that warrant further investigation to understand the reasons behind the differences and to ideally target interventions for improvement. While the focus is often on reducing antimicrobial use, the researchers also point out that higher levels of use do not always indicate a problem. For instance, an increased use of lower-tier, first-line antibiotics like amoxicillin or doxycycline might actually reflect good stewardship if these drugs are being appropriately used instead of resorting to higher-tier drugs like fluoroquinolones or third-generation cephalosporins. For example, current guidelines for treating bacterial bladder infections in dogs often recommend amoxicillin or amoxicillin clavulanate. A shift towards these drugs from a fluoroquinolone, while consistent with best practices, would likely result in an increase in the overall mass of antimicrobials purchased and dispensed. The study uncovered striking differences in the use of specific drugs or drug classes between the US and the UK. The much higher purchasing of amoxicillin clavulanic acid in the UK, even after accounting for the availability of injectable form only in the UK, is a significant finding. Conversely, the much lower use of third-generation cephalosporins in the UK is also notable. This difference is likely related to the availability and common use of a once-daily oral third-generation cephalosporin, cefpodoxime, in the US and its lack of licensing in the UK. These international variations highlight the limitations of using the total mass of antimicrobials as the sole measure of use, as factors like dosage, frequency of administration, and drug availability can significantly influence these numbers without necessarily reflecting the number of patients being treated. For example, the use of cefpodoxime, typically dosed at a lower milligram per kilogram amount and less frequently than amoxicillin clavulanic acid, would naturally result in a lower total mass of drug used even if similar numbers of patients were being treated. Similarly, the finding that cefuroxime, a second-generation cephalosporin, was only purchased in the UK, while cefazolin, a first-generation cephalosporin, was only purchased in Canada and the US, both being commonly used for surgical prophylaxis, would impact comparisons of drug classes, but not necessarily total purchases. These examples underscore the importance of understanding drug authorization, availability, potentially interchangeable drugs, and typical clinical recommendations when evaluating antimicrobial purchasing or use data across different countries. The time frame of the study, which largely coincided with the COVID-19 pandemic, is another factor to consider. The pandemic had variable impacts on veterinary facilities, including changes in how patients were seen and treated, which could have influenced antimicrobial use patterns in ways that are not fully understood. Significant variations in antimicrobial purchasing were also observed among different regions within the United States. While some of these differences might be explained by varying disease prevalence, such as higher doxycycline use in areas with more tick-borne diseases or heartworm, the reasons for differences in overall antimicrobial use and the use of drugs where regional disease patterns are less obvious, like cefovecin, warrant further investigation. These interregion differences could be related to variations in disease patterns, differences in antimicrobial susceptibility, or regional variations in veterinary education, continuing education practices, and even established habits within the veterinary community. Socioeconomic differences in the client population might also play a role. The comparison between primary care and referral facilities yielded interesting results, with primary care facilities generally purchasing more antimicrobials. This could reflect differences in treatment approaches, such as using antimicrobials more frequently or for longer durations in primary care, higher patient loads per veterinarian, or differences in the types of cases seen. Referral facilities, on the other hand, might see a higher proportion of cases with more complex or resistant infections, potentially explaining the significantly higher purchases of gentamicin observed in referral facilities in both the US and the UK. More detailed studies looking at the specific services offered and the prescribing habits of individual clinicians would be valuable in understanding these differences further. The researchers also acknowledge the limitations of the milligrams per full-time equivalent veterinarian per week metric. The study relied on a single FTE value for each facility over the study period, but staffing levels likely fluctuated. These fluctuations could have a more significant impact on the calculated values for smaller clinics. Ideally, more frequent, such as monthly FTE data, would be used. Additionally, the definition of a full-time veterinary position might vary regionally or even between facilities, potentially influencing the veterinarian's caseload. Furthermore, the data collected represented the purchase of antimicrobials, not their actual use in patients. While it's assumed that wastage due to expiry or returns is minimal, this could not be directly assessed. For the purpose of this study, it was assumed to have a negligible impact on the overall data. The study also assumed that the types of animals seen were relatively similar across the different practice networks, and the use of median values and non-parametric statistical analyses helped to minimize the impact of extreme outliers on the overall findings and conclusions. Similar to other studies that use the total mass of antimicrobials as a measure, variations in patient size can influence the results. For example, a clinic that exclusively treats cats and sees the same number of patients as a mixed small animal practice might have lower milligrams per FTE per week simply because cats are smaller and require smaller doses of medication. Despite these limitations, the researchers believe that this metric offers an alternative and potentially very useful way to approach antimicrobial use data in companion animal facilities, providing a more comparable measure at the clinician level. Looking ahead, the study authors highlight that improvements in electronic medical record systems, coupled with advancements in artificial intelligence and natural language processing, could eventually allow for much more detailed and specific studies of antimicrobial use across large numbers of veterinary facilities. Integrating data on patient clinical outcomes would further enhance these analyses. However, in the meantime, complementary approaches like the one described in this study help to fill a critical gap in our understanding. The researchers also point out the importance of ensuring that purchasing datasets capture all relevant antimicrobial purchases, including those sourced from human medical pharmacies, which might have been missed in this study for certain drugs like meropenem. The design of future purchasing-based surveillance efforts should carefully consider these potential data gaps. In conclusion, this study has provided a comprehensive overview of antimicrobial purchasing practices across a large number of companion animal veterinary facilities in Canada, the United Kingdom, and the United States. It has highlighted both the potential benefits and the challenges associated with using purchasing data for antimicrobial use surveillance. The novel metric of milligrams per full-time equivalent veterinarian per week offers a way to account for differences in clinic size and the difficulties in obtaining patient-level prescribing or dispensing data. The high-level data generated provide valuable information about general purchasing trends, differences both within and between regions, and variations among different types of veterinary facilities. Importantly, this study has identified high purchasing outliers, both overall and for specific drugs, as well as specific drug purchases that warrant further investigation. While no single metric or surveillance approach is currently perfect for monitoring antimicrobial use, this study demonstrates that analyzing purchasing data can be a practical and useful addition to our toolkit for promoting antimicrobial stewardship in veterinary medicine. Thank you for listening to the Veterinary Research Channel.